Hi everyone, my name is Lois Kelly. I'm a yoga teacher and a therapeutic specialist, and today I'm going to be talking you through some fascia release techniques for the upper back and shoulders. What we'll be using is, ideally if you have them, 2 tennis balls, but if not, 2 pairs of socks, and we're going to use these tools to help you release some of the connective tissue around these areas. We'll be helping ease out some tension that might have crept into the body, breaking up any knots or scarring that might have crept in there, but mostly keeping your tissues nice and healthy and hydrated so you can feel better. So like I said, if you've got 2 tennis balls, grab them. If not, grab 2 pairs of socks and just ball them up so you have 2 balls made out of socks. And then just grab a few things if you want to be more comfortable, maybe a blanket, maybe a cushion, whatever might be useful to you. And we're going to start by lying down on our backs. So lie down more towards the bottom of the mat, feet on the floor, hips on the floor, lie down. Before we do anything else, just take a moment, let your arms relax, let your head relax, and just notice how your back feels right now. Which parts of your back are resting comfortably on the floor and which parts of your back are naturally just lifting away a little bit. Perhaps noticing the same thing for your shoulders and your neck. Allow yourself to relax just a little. That's a key part of this practice. And then when you feel ready, we're going to grab, again, either the tennis balls or the socks, and we're going to place them either side of the spine, so they'll be about 1 inch apart, not on the spine, either side. And they're going to be somewhere in between the shoulder blades. So lie down first and then place the tennis balls or socks wherever feels most comfortable for you. It might take you a moment or so to have them even. You really want the tennis balls level or socks rather than one higher than the other. This might feel fine. This might feel really intense for you. If it feels a lot, maybe putting a cushion underneath your head will be helpful, or maybe putting a blanket between you and the tennis balls will make it less intense. But when you can, allow your arms to relax. This isn't a practice of no pain, no gain. If you are tensing more and more and more, you are not going to be able to release the tension in the tissues. Makes sense, right? So you should be able to breathe easily. You should be able to relax your jaw, if not make a change. So we've been here a little while already. If this feels useful, stay here. Or perhaps you want to start moving. So you're lifting and lowering the arms as option 1. So you lift them till they land either side of your head or near, and then bring them back down. If it's too much, please don't move. Maybe this feels useful, or maybe what feels more useful for you is bending at the elbow like a cactus and lifting and lowering the arms. It really depends where exactly you place the tennis balls or socks as to which arm movement will feel more useful. And you always have the option to be still. What we're doing here is called like a pin and a stretch. So you've got the tissues pinned in place with your body weight and the tennis balls, and then this movement you're introducing through the arms is just going to help break up any areas that have started to get stuck together. We'll all let the arms rest now, either side of the body, and just be still once more. You want to feel like you're melting down onto the tennis balls or socks rather than lifting up and away from. Notice if anything's gripping or trying to work. Your job is to try and relax and sink down. These techniques work really quickly actually, so we're already done in this area. So you're going to press down with the feet a little, and you're going to roll up so the tennis balls roll down, and you're finding another place but still somewhere in between the shoulder blades, not below them. You're still just either side of the spine, but not on the spine. Really important, we don't roll over spine. 1, it doesn't feel very nice, and 2, it's not going to do very much. So you're on the soft tissue either side of the spine. And we'll be still to begin, remembering your job is to relax as much as you can. If you can't relax, then again, make a change. Maybe lifting the head takes some of the pressure off. Maybe putting a towel or a blanket on top of the tennis balls helps. The fascia has a lot of roles in the body, but the one we're looking at mostly here is its ability to slide and glide. Imagine it wraps around everything, and it's what allows all this complexity within your body to move without getting tangled up. But sometimes it does get a little knotted, so what we're doing here is just freeing up some of those knots so your body can move as it should do. Option to move the arms again now, so either lifting and lowering as we did before, arms straight or bent at the elbows like a cactus or a goalpost. Or third option, if you're a little lower, this might feel nice, wrap the arms across the body as if you're giving yourself a hug, and then take the elbows nice and wide. And you're still moving in and out. It's a smooth, continuous motion, but if stillness feels better, just rest with the arms by the side of the body. Just move a few more times, not too much more. And now let the arms rest, and again settle in. Allowing yourself to feel nice and heavy. Breath is steady, jaw is relaxed. 3 more steady breaths here. Once more, last time. You're going to roll up so the tennis balls roll down. You might not be able to roll too easily if you're using the socks, so you might just place them where you need them to be. Now I'd like you to be somewhere underneath the shoulder blades. So you're in this middle section of the back where it's rib cage, still just either side of the spine. Maybe this is your spot, maybe this is where it's particularly tender. Pay attention here again, it's not no pain, no gain. So maybe as you come into that place that feels tender but not painful, which is kind of what we're looking for, maybe it almost takes your breath away for a moment, but that should go very quickly. If you find that you can't relax, if you feel that the tension is staying there or perhaps even increasing in tension, then you're going to move slightly away from that area so you're near it but not on it. You're creating this sense of pressure and release, encouraging the tissues to relax, so you do not want the body to be tensed up. Even if it's your nature to go all out. Your hips are on the floor. You might have noticed your rib cage really lift at first, but maybe bit by bit you can feel the weight of the ribs just sinking down a little more. Maybe, maybe not. If you're happy here, if it's already a lot, be still. And if you're using socks, I would probably be still. But if you'd like to explore, press the feet down, lift the hips, and you're just going to explore gently, rolling up and down the spine. So you're rolling along the length of the tissues, still not rolling over the spine itself, just next to it. And maybe as you do this, you find a place that feels a little more useful. And by useful, I mean tender but not painful. Find a spot to be still, then everybody rest once more, hips heavy. Rib cage as heavy as it can be. Breath steady. Just 3 more breaths here. Press the feet into the earth so you can move the tennis balls or socks out of the way, then come to lie on your back. And as you lay here, almost melting down, maybe you notice a difference in how your back feels already from a few minutes ago. Being interested as to which parts of your back are now in contact with the floor. Stay here as long as you feel comfortable to do so.